Psychedelics are substances capable of altering consciousness in profound ways by temporarily inducing sensory and psychological changes in the brain. In some non-Western cultures, psychedelics are seen as mystical tools for religious ceremonies, enabling contact with the spiritual world. And there are many people who consider psychedelics as substances of abuse, like any other illegal drug. But there is a new idea emerging, spurred by research into psychedelics as safe medical treatments for mental health conditions, including depression, addiction, OCD, existential anxiety, and suicide ideation. Because these substances have been illegal globally for decades, it is understandable to be skeptical about this. But consider this: 300 million people are afflicted by major depressive disorder. 100 million of them are treatment resistant. The rest are dependent on traditional antidepressants with their known side effects. And more than 700 million other people are afflicted by serious anxiety disorders. Even if you are skeptical, the scope of the problem for individuals and society demands that we investigate all possible cures, including psychedelics. So what exactly are psychedelics? Where do they come from? Why have they been made illegal in the first place, and why are they being rediscovered now? Will they be made legal again? And how does a psychedelic treatment work? Psychedelics work by activating the 5-HT2A receptor in the brain. This receptor is also known as the serotonin receptor because it is normally activated by the neurotransmitter serotonin. Serotonin is associated with mood modulation, cognition, learning, and your brain's reward system. Psychedelic substances which activate the serotonin receptor include psilocybin, mescaline, LSD, and DMT. So, where do these substances come from? Nature. For instance, psilocybin is a compound found in over 200 species of fungi, which are often called magic mushrooms. Mescaline is found in the peyote cactus, another North and South American cacti species. LSD is derived from lysergic acid, which is found in ERGOT, a fungus that grows on rye and other grains. DMT is found in mixtures of different plant or animal products. This includes the AYAHUASCA brew, prepared by many Amazonian tribes for ritual purposes.
Well, as far as we can tell, I mean, psychedelics are as old as the human story. In my book, I trace them back about 13,000 years to the agricultural revolution, but we can surmise that the human interaction with drugs far precedes that. If not by tens of thousands of years, hundreds of thousands of years, the use of psychedelics could precede the human species.
In fact, there is archaeochemical evidence that Neanderthals used medicinal plants dating as far back as 50,000 years. Artifacts such as mushroom-shaped stones have been found in the Americas, suggesting primitive use of psychedelics. The mythical soma in ancient Sanskrit texts has been hypothesized to be derived from the AMANITA muscaria mushroom. Similar evidence has been found around the Eleusinian mysteries, the famous mystical rituals of ancient Greece. It is believed these involve the consumption of beers and wines spiked with ergot, the fungus from which LSD is derived. Chemical evidence has shown the presence of ergot in ancient chalices.
So in the 1990s, these archaeologists dug up this ancient Greek site, and inside this ancient sanctuary complex, they discovered a tiny chalice, only a couple inches high. And inside this chalice, again, in the mid-1990s, the organic residue of a beer, an ancient beer, was discovered, dating back about 2,200 years, so to the classical period. But in addition to that residue of beer, again, in a very tiny chalice, which is strange to begin with, the archaeobotanists also discovered the microscopic remains of ergot, and this was under optical microscopy and scanning electron microscope.
The evidence of the use of psychedelics has sparked several conjectures about their role in the origin of Eastern and Western religions.
I don't think that psychedelics, for example, were involved in every single ancient ritual. I don't think they explain the origin of the monotheistic religions. I don't think Moses was high in stories about the burning bush. I don't think Paul was drinking psychedelics when he had that that heaven-sent flash of light that's recorded in the New Testament. What I do think is that visionary experiences, strangely, seem to be common in antiquity and very much integrated into religious experience. And what I think is that sometimes, at some point, for some communities, the use of psychedelics may have facilitated those visionary divine encounters.
It is clear that psychedelics have been present in civilizations around the world for the entire course of human history, particularly in association with ritual and religion. But the birth of the modern psychedelic movement didn't occur until 1943. Albert Hofmann, a chemist with Sandoz Labs, has synthesized a lysergic acid derivative for pharmaceutical research in 1938. On April 19, 1943, while revisiting his earlier experiment, he accidentally ingested some LSD. As the first modern LSD trip kicked in, Hofmann thought the unfamiliar experience meant he was dying. He rode his bicycle home as his final act. But once he realized he wasn't dying, he relaxed and realized he'd discovered something transformative for his psyche. At the time, food and drug regulations were lax or non-existent. LSD quickly entered the psychiatric canon as a useful tool throughout the 50s and early 60s. By enabling patients to recall repressed memories and trauma, it allowed them to break the shackles of many neuroses. It also quickly became apparent that the intent of the therapy and setting the environment of the trip were critically important to the experience. In 1958, Albert Hofmann and his team identified and synthesized psilocybin, the principal component in magic mushrooms.
We rediscovered the properties of psilocybin in the form of the natural product in terms of so-called magic mushrooms in the 1950s, when an explorer went to Mexico to go and hunt for the magic mushroom, and he found a tribe of Mazatec natives in Oaxaca. Took a sample, sent it off to Switzerland to Sandoz Pharmaceuticals, where Dr. Albert Hofmann investigated these mushrooms, discovered psilocybin, synthesized it, and as a good chemist used to do in these days, he tried it himself and realized that it was indeed a strong psychedelic, not too dissimilar from his earlier invention, LSD-25.
Psilocybin occasions an experience as powerful as LSD. But while LSD experiences can last 12 hours, psilocybin tends to last around 6 hours. This makes it more practical in clinical settings than LSD. It wasn't long before psychedelics leaked out of the scientific and therapeutic communities and were popularized among the younger generations by a few key figures. Clinician Humphrey Osmond, a pioneer of the use of psychedelics for the treatment of mental disorders and addiction, coined the term psychedelics in 1957. In 1953, Osmond had administered mescaline to Aldous Huxley, a prominent writer and intellectual of the time. Huxley became an advocate for psychedelic experiences, and his novels helped them gain mainstream acceptance. Timothy Leary was the head of the Harvard psilocybin project from 1960 to 1962. When his experiments drew concern from other faculty, he was fired along with his associate Richard Alpert. Harvard's firing of the pair was like throwing petrol on the fire of the 1960 counterculture movement. Leary became the frontman for exploring the fringes of consciousness, coining the term tune in, turn on, and drop out, while touring college campuses promoting the safe use of LSD. And Alpert became Baba Ram Das, one of the leading spiritual figures of the 1960s, writing the seminal text Be Here Now. Many artists of the time, ranging from Cary Grant to the Beatles, also popularized the use of LSD. And all of this led to millions of people using LSD in recreational context, disregarding the important set and setting adopted in clinical use. While things often went well, this sometimes led to very bad trips, and the bad trips sometimes led to injuries, deaths, and lives ruined. This development aligned perfectly with the US government being keen to shut down the counterculture movement.
They did research, and that coincided with the counterculture movement, the hippie movement, flower power generation in the United States, the global anti-war movements, and eventually the US government stepped in, and they were looking for an excuse to shut down the especially anti-Vietnam movement, and LSD was the drug of choice of the hippies. So very quickly, the US made all psychedelics illegal recreationally.
All psychedelics, including psilocybin, were made illegal in 1968. In 1971, the UN published a control schedule for psychedelic substances, officially putting a halt also to all medical research around psychedelics. In the 80s, a new class of drugs took prominence for the treatment of depression, anxiety, OCD, PTSD, and eating disorders. These drugs are known as selective serotonin reuptake inhibitors, or SSRIs. It was understood that serotonin levels in the body could affect mood. Increased levels of this neurotransmitter seem to correlate with mood improvements in depressed patients. Fluoxetine, also known as Prozac, was one of the first SSRIs to be widely adopted. The problem with SSRIs is that they have side effects such as sexual dysfunction or increased suicide risk. They also do not work for half to 1/3 of the patients. As a growing number of mental health patients had unmet needs, the stage was set for new research into psychedelics.
Look, I think there are a couple of factors that allowed this re-emergence of psychedelic therapies to happen. I think scientific understanding of what do psychedelics do in the brain, huge unmet medical need in the patient populations that are underserved, a new regime at the FDA and the EMA that were not part of the anti-war movement of the late 1960s and 1970s, so they're much more open-minded.
In 2006, a research group at Johns Hopkins published a landmark paper on the safety and enduring positive effects of psilocybin. They also demonstrated the effectiveness of psilocybin at easing the end-of-life distress for terminal cancer patients. In 2015, a research group at Imperial College London conducted a proof-of-concept study which gave promising signals for the safety and efficacy of psilocybin for the cure of treatment-resistant depression. The study, led by researcher and Compass Pathways advisor Robin Carroll Harris, paved the way for Compass to receive the breakthrough therapy status from the FDA in 2018. This set the stage for new large-scale clinical trials on psilocybin, which are currently underway.
More recently, we did what's called a double-blind randomized control trial. A scientifically rigorous trial with two groups where it's a kind of coin flip whether you go into one group or the other one. That's the randomization, and you don't know what group you go into. That's the blinding, and no one knows. That's the double blinding. And one of the conditions was getting psilocybin, and I should say psilocybin therapy. And in the other group, you go on to 6 weeks of a conventional antidepressant drug that you take every day for 6 weeks. And the main findings from both studies, put simply, is that psilocybin therapy seems very effective.
So these patients had a psilocybin therapy session, and if they responded immediately after the session for prolonged periods of time that often were measured in months, which is unheard of in psychiatry. And so when we saw that and shared that with the regulators got really excited because they realized that this is real. There was a strong signal, and they now want to understand what happens in a large patient population.
This is part of a new wave of medical research and regulatory approvals around drugs considered illegal. These include compounds such as ketamine and MDMA, also known by the street names Special K and ecstasy respectively. These drugs create experiences similar to psychedelics, including consciousness-altering action and psychological and dissociative properties. In 2017, the FDA granted MDMA-assisted psychotherapy the breakthrough therapy status for the treatment of PTSD. In 2019, the FDA and EMA approved the use of esketamine, a compound related to ketamine, for treatment-resistant depression. It is currently sold as a nasal spray called Spravato by Johnson & Johnson. And in the past few years, psychedelic compounds such as psilocybin have been decriminalized or made legal in US cities and states, including Denver, Oakland, Cambridge, Ann Arbor, Washington, D.C., and Oregon.
So when we started at Thai Life Sciences, our main fear, or the main challenge we saw, which didn't materialize, was actually how will regulators and politicians together react on our idea to bring back psychedelics back into the medical world. Interestingly, they actually were very open for us to do so. And the reason is because the problem is just so big. So, and actually everybody knows that psychedelics are, they're not the only solution, but are most likely the best group of drugs we have to solve the mental health crisis. So pressured by the problem and supported by the science behind it, it was actually easier than I thought.
While much about the neuroscience of psychedelics is still unknown, it is theorized that the action of psychedelic compounds such as psilocybin on the serotonin 2A receptors introduces a disturbance to the normally synchronized oscillations of signals in the neural networks. This is a bit like a group of people starting to clap out of sync in a crowd, eventually breaking up the rhythm. This increases disorder in the signal passing through the receptors, which in turn breaks down the barriers between different networks in the brain, so that visual signal, sensory, and other cognitive signals become more connected and conflated.
It all begins with the molecule, the drug molecule, getting into the body and getting into the blood. And once in the blood, these molecules are going to get into the brain. And in the brain, the molecules will bind to certain receptors, which are proteins on neurons. And then they'll change the activity of these neurons. And as we zoom out and look at a bunch of neurons, hundreds, maybe thousands of neurons, we start to see their population level activity. We see how they're moving together, and they move together. Their activity, their electrical activity moves together as waves. And if we look at those waves across time, when a psychedelic is acting on the serotonin 2A receptors, these important receptors, it's making those waves more unpredictable, more entropic or chaotic, you might say. And when we put people in an MRI scanner, we see that whole system, and we see these distributed networks that cross the entirety of the brain, the full spatial extent. And so we can visualize that, and we can look at the dynamics of these systems. So we can map the whole of the brain. We can see how it's more globally interconnected, and how that correlates with people's ratings of certain experiences that are characteristic to the psychedelic experience, like ego dissolution, like the dissolution of boundaries between oneself and the rest of the world. And what goes with that, a sense of interconnectedness, a sense of oneness with things. So there does seem to be a level of mapping which makes kind of mechanistic sense, sort of intuitive sense. And that's important, because these drugs don't work through some kind of, metaphysical magic.
This temporary rewiring of the neural networks might explain why psychedelics can drive some patients to rethink and possibly abandon entrenched beliefs and break compulsive thought patterns and behaviors, in a process known as neuroplasticity. Psychedelic substances, therefore, appear to work on a dual level. The first is the experiential level. During the psychedelic trip, the patient undergoes a strong psychological and subjective experience in which it is possible to relieve past and suppressed trauma with more clarity. It is also possible to feel a sense of dissociation from negative feelings. The second level is the increased plasticity during and immediately following the trip. This allows the patient to reimagine things from a new perspective and abandon compulsive patterns of thought and negative habits. The combination of these two effects peaks during the trip in what is known as ego dissolution. This is a state achieved when our self-identification and association with all mental patterns is abandoned in favor of a sense of oneness with the surroundings and interconnectedness between all the thoughts and experiences in our life. Ego dissolution is considered a positive phase of the psychedelic drug therapy.
If you look at the character of these most prevalent psychiatric disorders, what you find in a sense is the opposite of plasticity. You see that the brain and the mind and behavior becomes rigid. It's not adaptable. It's not soft and shapeable and moldable. It's not plastic. And the fancy term is that it becomes canalized, which it means it forms in a particular way and then becomes actually resistant to change, kind of hardens. And that's what you see in depression, that's what you see in addictions, that's what you see in post-traumatic stress disorder, what you see in obsessive compulsive disorder. You see certain ways of thinking and or behaving that dominate, that become biases in the way that we are. And so the solution then, you would think, would be to introduce some chaos into that system, some noise, some kind of temperature in a way, increase the temperature so the system can shake up and become more plastic. And that's where things begin with psychedelic therapy.
To take full advantage of the beneficial effect of psychedelic drugs, the therapy must take place according to a precise protocol known as the container, which includes 3 separate phases. In the preparation phase, the clinician, often a trained psychiatrist, prepares the patient for the experience of the trip, setting up goals and expectations. This is particularly important to create the correct mindset prior to the therapy, especially for psychedelic naive patients. The second phase is the therapy itself. The patient is administered a dose of the psychedelic compound such as psilocybin or psychedelic-like compounds such as ketamine or MDMA. They then rest on a bed, blindfolded and wearing headphones. The setting is a calming and neutral environment resembling a living room. The therapist is present to supervise and be available. A carefully selected musical playlist guides the patient through different emotions and phases of the psychedelic trip. The blindfold ensures the experience remains introspective. After the session comes the third phase, known as the integration phase. In this phase, the patient works with the therapist over a few days. They take advantage of the increased neuroplasticity to abandon old negative habits or thought patterns and form new and positive ones.
The drug does the plasticity, but plasticity in and of itself isn't necessarily healing. It's just an opportunity. So you need to take that window of opportunity, seize that plasticity, and work with the therapy to try and shepherd things quite gently, really. It's more a shepherding, a guiding in the positive direction.
And what is so interesting is that in these experiences, oftentimes some deep-rooted problems of these patients show up. This could be, for example, some type of trauma, some childhood trauma for something where something terrible has happened, and the patients work through that trauma, they process it, and coming out of it, they feel that they're not weighted down by their trauma. It could be a situation of learned helplessness. It could be a situation of prolonged grief where a patient did not process the death of a family member or friend, and the grief became a deep-rooted depression. And in these sessions, they can often work through that grief and see a clear path forward. And the negative attentional bias, which is at the core of the depression and anxiety disorders, changes to a positive attentional bias in these patients, and they approach life very differently, supported by the integration therapy after.
Many patients report this whole treatment to be one of the most significant experiences of their life. And importantly, the clinical results are extremely impressive. Many patients afflicted by crippling treatment-resistant depression and PTSD find success in a few sessions of psychedelic-assisted therapy. This after trying different types of SSRIs and traditional psychotherapy over many months or years. For instance, for one patient who grew up in a country gripped by civil war, the therapy was life-changing.
My psyche actually started to recognize the male and female therapist as a mom and father figure. It almost was like it reverted me back to this, vulnerable childlike place where it was like, okay, here's father protection, here's mother nurturing. The integration part is allowing my body to recognize that I'm safe on a day-to-day, that I no longer need to be in the past.
Patients have shown remission from mental health conditions after as little as one session, with effects lasting for up to a year, and with no side effects. This is in sharp contrast to the requirement that many traditional SSRIs be taken daily and that a patient must endure the side effects.
Anti-anxiety medicine actually numbed me even more. So all of this was, I tried for a few years, and it was just every day I just felt more and more hopeless and sort of desperate to feel better. And I think personally, if you have complex PTSD, it's a long road, and if you've reached a certain point where everything is coming up and you're in a place where you need answers, For me personally, psychedelic assisted therapy was what really broke through for me into feeling like I actually have a way out of feeling so low, like an answer to really living my life, and that there is those possibilities.
It is important to understand at this point that however promising psychedelics might be, they are not a panacea, and there are also a few challenges ahead. A single compound or therapy might not work for everybody. Just like a fever is just a symptom of several different types of bacterial or viral infections, depression is only the symptom of a large array of potential underlying factors.
Depression is a very heterogeneous indication. So the symptoms associated with depression are likely a final common pathway for many underlying pathophysiologies. And so different people will respond to different drugs.
Psychedelic assisted therapy is still costly, as it requires involvement of the clinician, a 3-phase procedure, and a clinical setting. This is in contrast with SSRIs, which are generic medications, meaning they are very cheap and easily available, which is what makes them so widely adopted. The infrastructure needed for large-scale distribution of psychedelic-assisted therapy is still non-existent. A lot of work is needed to ensure rapid scalability, which might include the adoption of digital solutions, such as remote therapy.
So the scalability is something that is front and center in my mind. And so the way we're approaching this at Atai is through digital therapeutics. We have announced a company called Introspect, and that is providing a digital therapeutic that will support the patient through these different phases.
Finally, more precision is needed at the diagnostic level. Some breakthrough companies are now working on developing more precise neurological tests, which will be able to better assign specific treatments and medications to patients affected by different mental health conditions.
There's no blood test in psychiatry, there's no MRI tests, there's nothing that tells us what's actually going on with that person. And so when we prescribe a medication, it's basically trial and error the whole way. We guess at the first medication. If it fails, we don't really know what the next medication should be. At Alto, what we do is we develop objective tests coupled with drugs that we are developing to try to understand who will respond to one kind of intervention or another, so that we get the right drug to the right patient and it's effective without that trial and error. So one example is EEG or electroencephalography. EEG is a recording on the head. In fact, you see right there a cap on a mannequin that records brain waves or electrical activity in the brain with electrodes placed non-invasively on the scalp. So that tells us what's going on in the brain. And then we use machine learning to decode that information and tell us what kind of brain type, if you will, the person has, and what kind of intervention the person will respond to.
Additionally, research efforts are directed towards the simplification of psychedelic therapies and an increase in their efficacy. These efforts focus mainly on the discovery of alternative psychedelic compounds with shorter trip durations or non-psychedelic compounds with comparable benefits.
DMT stands for dimethyltryptamine. It is the active moiety in ayahuasca, and many of you may be familiar with that. Now, one of the big differences between psilocybin and DMT is that DMT has a very short half-life. So the trip associated with psilocybin is many hours, right? Somewhere in the roughly 4 to 6 hour kind of time range. And what that means from a therapeutic perspective is that the patient has to stay in a doctor's office for an extended period of time, essentially the entire day. With DMT, the half-life is somewhere between 7 and 10 minutes, so really short. And with our formulation, we anticipate the entire psychedelic effect to be completed in about 45 minutes. And that's really important. It improves the logistics of treating a patient substantially.
Other psychedelics such as ibogaine are undergoing clinical trials and showing promising results in the treatment of addiction. Ibogaine seems particularly effective in the treatment of addiction to opioids such as fentanyl or heroin, which is currently afflicting millions of people in the USA alone.
Ibogaine is it's the active alkaloid from the iboga plant. That is a plant, the bark of that plant has been used ritualistically for presumably centuries in parts of Africa. The compound itself has gained use in the West for the treatment of substance use disorders, as well as other things like PTSD. So in the context of substance use disorder, the promise is really pretty impressive, or really quite incredible. And that is that a single dose of this drug given to a patient with opioid use disorder can, number one, facilitate a really rapid withdrawal, and number two, can promote a long-term abstinence. And so that part is really quite incredible.
Additionally, work is being done to discover new non-psychedelic compounds that can cause increases in neuroplasticity, but without the psychedelic trip.
The drugs that we're developing are drugs that are not psychedelics. They don't, for the most part, induce a subjective change, but they induce the plasticity change that I think we and the field as a whole, and certainly people focusing on psychedelics, think is really going to be the active ingredient for an effective therapeutic. But of course, not for everybody. It's important to note that for any one of these drugs, we are 100% certain that we'll need to find the subgroup that responds really well, because there is often a subgroup that responds really well. I think a greater understanding of mental health and the impact of stress on all of us, the stigma that comes with mental illness, the stigma that prevents, frankly, half of people with depression from even getting treatment in the first place. That stigma is something that we can fight with objective measures that give the patient comfort that we can understand their disease finally for the first time, to prevent or to treat better, and tell society that it's not just the experience and therefore hard to get to know because I can't get inside your head. But there is a biological fact that's changed in the brain. And my hope is, with enough of that, the stigma is going to be such that it diminishes and people get more treatment, get diagnosed earlier, and get better faster.
I think the bigger picture, the biggest one is our world is changing so quickly. And so I deeply believe that somewhen psychedelics could be considered not just a treatment for things we call an illness now, today, but that it could actually be beneficial for all of us, because we are about to transit into a completely new world. The next 20, 30 years, there will be disruption and innovation like humanity has never seen it before in such a short period of time. And I think we all need support to find a place in this new world.
The war on drugs of the 70s has led to a slowing down of scientific progress, with many people suffering from mental health disorders remaining underserved for a few decades. Luckily, medicine and science have advanced in parallel to the return of open-mindedness and the shedding of prohibitions, meaning we have now made up for lost time in the matter of only a few years, a testament to the fact that progress is relentless, and we must be grateful for it. If you'd like to learn more about any of these issues, check out the link below or visit rationalmind.show for more information and resources.